Okay, so we're moving on to chapter 6. Chapter 6 is on opioid analgesics and antagonists, and I'll tell you what this terminology means. Opioid, we know that that's basically a drug that is addicting, narcotics or something addicting. Analgesic means a pain relieving drug. An antagonist basically means that if someone overdoses, if someone takes too much opioids, then there is a drug which we'll talk about that will prevent the overdose, that will kind of stop the overdose, and that's an antagonist. An antagonist is something that stops the medication from working. So, what is an opioid? Opioid comes from opium, which is a plant, and there's dried juice inside that plant, and this plant has to be unripe, so you can see it's not ripe at all. And the dried juice basically gives you that opiate feeling. It gives you the feeling of intense euphoria, the intense happiness feeling. So before until 1920s, people were using opioid medication, and after that, they realized that people are abusing it so much it became unlawful, and that's basically where people started injecting it to themselves, and so that still continues today, unfortunately. So how does it work? So believe it or not, inside our body, so endogenous means inside, so endo basically means inside our body. So inside our body, we have substances that give us an opioid like feeling. So these are the substances we have inside our body. You may have heard of endorphins. Endorphins is released when we feel good. So after eating something good, after sex, after exercising, endorphins would be released. And that gives it makes us feel really good. Now, what happens to our body? So if I show you the next slide, and I'm going to skip back and talk about this slide, but let's look at this slide here. Let's say you went for a run and now you have like the runner's high. You feel so good after that run, or you just worked out and you have that really good feeling. Well, how is that feeling coming to you? The signal, that good feelings signal, has to be passed through. So the good feeling signal gets passed through this neuron, and it has to bind to a receptor over here for you to feel that runner's high, or for you to feel that intense happiness feeling. So if you want to feel intense happiness, what's happening inside your brain is that there's a signal getting passed through over here, and then that something comes out and it attaches to a receptor. So endorphin could attach to this receptor, and when endorphins attach to this receptor, it makes you feel good. It gives you that runner's high. There are three types of receptors. There's mu, there's kappa, and there's delta. So if I go to the next slide, this receptor could be called mu. This receptor could be called kappa. And let's just hypothetically say that this receptor is a delta receptor. So endorphins could bind to any of these receptors. Usually they have a specific receptor that they bind to, and when they bind to that receptor, they make you feel good. It gives you that good feeling. And that's how opioids work. Opioids, when they come into your body, they have to find an opioid receptor. It could be mu, it could be kappa, it could be delta. They bind to them and they make the person feel good. So, what do opioids do? They help with pain relief. They can sedate you, so in high doses, they can put you to sleep. They give you that intense happiness feeling, euphoria. They actually help with cough. So if you're coughing like crazy, opioids actually help. Gastrointestinal effects. So what happens is when you take an opioid, remember what opioid does is it calms your whole body. It kind of stops or slows down your whole body. And so when it slows down your whole body, think of what's going to happen to your digestive system. The food won't be pushing through the intestines. It'll just sit there. And when it just sits there, you feel constipated. So constipation is a huge side effect of any opioid. So people who take Tylenol 3, which is an opioid, or codeine, which is an opioid, this is they do complain of constipation because the digestive system isn't working, it isn't pumping the food through, and when it just sits there, when the food just sits there, you get that constipation feeling. one of the huge adverse effects or the huge side effect is respiratory depression. And that's basically where a lot of people die because they can't breathe. Their lungs, right? They can't breathe. Their heart rate just goes down and they die because they can't breathe. And that's very common with an opioid overdose. So nausea is a huge side effect of opioids. They say that if you take an opioid and if you stay kind of still, you won't get nauseated. But if you're kind of moving about, you will feel nauseated. Emesis is the same thing as nausea. You could feel constipated, like we talked about. And another huge thing is meiosis. So people who overdose, this is the normal pupil, which is the black thing is the pupil. This is pinpoint pupil. And you can see here that people who overdose will get pinpoint pupils, will get meiosis. So that's an adverse reaction. And then urinary retention. That basically means that, you know how when we take an opioid, our body just slows down completely? Well, if our body slows down completely, it also, unfortunately, what it does in this case is it keeps our urine inside. It won't, let the urine pass. So it retains urine. It also can make us, anxious, restlessness, nervousness, or depressed. So those are also some other side effects that could happen, may not happen. Usually it makes us feel a lot better, but sometimes these could happen. So it's very, very easy for us to get addicted to opioid drugs. And 2 signs of addiction is cravings. We get that intense urge to take another pill or to take another injection of opioid. And we can't stop using. We just have to keep using. We have to keep using. So those are the 2 signs of addiction. I'd like you guys to pause the movie and watch this. This is it's a short clip on how people get addicted to opioids. So when a doctor prescribes opioids or when a dentist prescribes opioids to our patients or to our clients, it can get misused quite easily. And when it gets misused, people get addicted. So have a look here to see what happens when people misuse it. So a good or an adverse rather reaction that could happen to opioid use is addiction, right? People will get addicted and it happens very easily, as you saw in that video. And they're so dependent on that drug because it gives you that intense feeling, and the anxiousness that you had, it's kind of gone. So it gives you a really good feeling. Now, before we're talking about antagonists, so in the title of the chapter, it said antagonist. And what antagonist means is something that stops opioid use, a drug that you put into your body that stops opioid from producing that good effect, producing that high. And that drug is called naltrexone. And naltrexone is an opioid antagonist. It stops the opioid from working in the body. So anytime someone has an overdose, we would want to give them this drug over here. And of course, if someone's unconscious, you could give them an injectable form of this drug. So here are some examples of opioids. And the ones at the bottom are less potent or less strong, and the ones that are on top are the most strong. So morphine is a really strong pain reliever. But we have codeine like Tylenol 3, hydrocodone, oxycodone, and then morphine, which is the strongest. Now, when you're in the dental chair, it's really important that you hide all the prescription pads. So if your client rather is on the dental chair, make sure that the client cannot see any prescription pads because they may take it and just, pretend that they're prescribing themselves opioids. Remember, the key medication for pain reliever is NSAIDs, so Advil, and sometimes aspirin can help with dental pain. If a dentist were to prescribe opioids, they should just prescribe the minimum that they need, not excess amount, because any excess amount that's left behind, the patient could use it and just keep using it and they would get addicted. Or if it's sitting there, family members could use it and abuse it that way. And there's a misconception that if you just give a little bit of opioid drugs, it won't cause addiction. And that's not true. Even a little bit of drug can cause addiction. So it's really, really important that we stay careful when we're prescribed opioid drugs. We're mindful that it can lead to addiction. So if we have clients, we want to make sure that are taking opioids, we want to make sure that there's no signs of drug abuse. And sometimes what can happen is the client may, call the receptionist and say, I'm not able to come in right now, but can you ask the dentist to give me a prescription of more opioid drugs? And if the dentist does, that's pretty bad, because what a dentist should do is the dentist should say, no, I'm not going to give you a prescription over the phone. You need to come in. I need to make sure that you're not lying. I need to make sure that I actually see signs of pain and infection in your mouth before I give you that prescription. Because there are many, the clients can get very crafty when it comes to getting or receiving opioids. We even have clients that might call the day before they're supposed to come in and say, I'm at the pharmacy, I have time right now at the pharmacy. Can you just give me the drug right now, and I'll get everything ready for the surgery that we're going to have tomorrow. So let's say the day after they have a wisdom teeth extraction, and they know that they're going to be prescribed an opioid drug to help with that pain. So if they call the day before and they say, can I just get that prescription now so that I can pick it up and have everything ready for when I get my wisdom teeth removed, that should kind of be a red flag, because if you don't know that client, chances are that that client may cancel on you the next day, and what that means is they just took advantage of the dentist, got that prescription without even coming in for a wisdom teeth extraction. They just booked an appointment just so that they could get their hands on that prescription. And so you can see there are many ways that the clients can get crafty just so that they can get that prescription. They also do doctor shopping, where they go from doctor to doctor or dentist to dentist to see who would prescribe them that opioid drug. So it's really interesting to see what clients do, what patients do to get their hands on that drug. So as a hygienist, it's important that we find out whether they are on opioid drugs or not, because if they are, we can keep an eye out for addiction or abuse. Sometimes we get people taking non-opioid and opioid combinations. So they'll take codeine and they'll take an Advil, for example, together. When they're taking an opioid drug, you want to make sure that they avoid making any life-changing decisions, because remember, opioid drug just slows down your whole body and you're not as conscious, you're not as alert to make life-changing decisions. If they're taking opioid drugs and they have an upset stomach, which is a side effect, in a semi-supine position, so don't put them all the way down, lift them up a little bit so that it doesn't upset their stomach as much. An opioid can make you very sedated, it can make you very sleepy and tired, so not to drive when they take opioids. Take a full glass of water, take it with food so that your stomach doesn't get upset. And remember, it can cause xerostomia. So if someone has xerostomia, lots of water, no caffeinated drinks, no juices, no sodas. Sodas have a lot of sugar. Juice also has a lot of sugar. So someone with a dry mouth, you want to avoid lots of sugar because that increases the chance of them getting cavities.